which is off-site, not on this campus. We are going also to have Center for Aging in coming years. The hospital, covering all centers and main hospital, we have close to 2,500 indoor hospital beds. And at the moment we are in the phase of expansion because there is a huge demand and we are not able to cope with that. So we are going to add in next 3 years almost 1,200 beds in this campus. And then in next 10 to 15 years, we are keen to add another 2,200 beds or more in our various projects which were ongoing at this time. The institute, with an internal phase and perspective with collaboration with many US, Australian, Swedish, Canadian, Taiwanese, Japanese medical universities and medical schools, SAARC countries, and this collaboration with French Academy of Science, the medicine is going to, they are very important ones, as President also desired that we can have these meetings every 2 to 3 years and we can schedule them as mutually convenient calendar can be prepared for these meetings. France has been at the forefront of development of medicine, Mr. President. But somehow the English channel has been very long. So between English and French, the French were not even publishing their good work in English, which held back much important work done in France from all of us who read and understand English. I'll give you one example. The anatomy of liver was described by someone in 1954, published in a French journal. And that could be known to rest of us only in 1980s. So what I say today, I know we are all proud of our mother tongue. We are all proud of our own language. But we need to have a language of international communication. Somehow, whether we like it or not, whether we want it or not, English did become the international language of communication. Although I know that in United Nations, French is equally given importance. But because in medical field, the huge literature is being published in English language, largely from USA and from other countries also. So if we can overcome our emotions, I think we can do much better at that front. And now, learning from that anatomy now, there are many procedures have been transformed over the last 30 years. I visited France first time in 1989. I had visited Strasbourg to look at the emergency services. I again visited Strasbourg in 1991 when laparoscopic surgery was just beginning. And it was heartening to note that most senior surgeons actually could communicate with me in English, even in 1991. And you have done so much research and landmark discoveries, which we have been reading in our textbooks over many years. Recently, we had hosted an East Asia Summit on trauma care and nursing in October 2015. We are also going to have, Mr. President, a World Trauma Congress in August 2016, which is being hosted by AIIMS and Indian Society of Trauma and Acute Care. And I take this opportunity to extend a very warm and hearty welcome to the delegates from France, and I'm sure we'll have a huge participation from France where we can learn providing trauma care, emergency care, all aspects of critical care. We have known that emergency services in France are very well organized. The pre-hospital care, the efficient hospital care, the SAMO system. We are aware of that and we would like to learn from that. This conclave between AIIMS and French Academy of Medicine on public health and medical innovation represents a significant milestone in bilateral cooperation in health sector between these two great nations, enabling sharing of the best practices between the two countries. And what I consider, if something is good for our two nations, it will be good for the world also. In the areas of cancer research, cancer care, cardiology, but we can learn a lot in other areas of medical education, research, online examinations, public health issues, and also hospital administration. We also had a delegation from France last year of the medical superintendents of various hospitals from France. If you look at WHO projections for 2025-2030 and compare with in 99, where the infectious diseases were far more prevalent and taking the toll, injury was at number 9 position in terms of disability adjusted life years lost, because injury is the disease of the young. According to WHO projections, by year 2025 and 30, some of the success stories from AIIMS in introducing several new academic programs and also undertaking research work in the areas of pure sciences, benefiting us and the students. 500 odd PhD students work in these areas at AIIMS. As an institution, we have been contributing towards public health initiatives for a long time. And recently, during dengue upsurge, the work what we did was appreciated. And tuberculosis and other vector-borne diseases are also being taken care of. As a mentor institution with the upcoming new AIIMS, we have been entrusted with the responsibility by the government, and we have been successfully conducting nation's largest online entrance examination for MBBS students, with over 500,000 students taking that examination. We have established successfully once called Stanford Biodesign Project, which is now called as a School of International Biodesign, with the possibility of collaborating with countries like France in frugal medtech innovation, and we will look towards that. We have also developed less invasive and non-invasive surgical and interventions in cardiology, in neurosciences, in general surgery, in gynecology, in ENT, and so on. We have a dedicated stem cell facility at AIIMS. We also were the first ones to have done the first cardiac transplant in Asia. Pancreas, kidney transplantation together. If we take the research, the All India Institute of Medical Sciences as a medical institution publishes largest number of peer-reviewed articles in various scientific journals, and we are proud of that. We have also contributed towards establishing certain vaccine programs in India, like for hepatitis B. We were involved in the studies done for prevention, the vaccine used for the prevention of carcinoma cervix, HPV vaccine, and many other areas. Ladies and gentlemen, the delegates from France will look forward for a rich exchange of knowledge, ideas on which we can work in near future and develop our goals for times to come. And I agree with the President that we must prepare a calendar for 2 to 3 meetings, joint meetings every 2 to 3 years. And individually, the faculty from both sides can collaborate and develop mechanism where we have a very close knit interaction. I again wish you all a very successful conference, and I'm sure the deliberations would bring good results. Thank you so much.
Thank you, sir. May I now request Dr. G.K. Rath, Chief, IRCH AIIMS, to deliver the vote of thanks.
Dignitaries in the dais, dignitaries of the dais, ladies and gentlemen. It's my proud privilege to have been asked to deliver the vote of thanks for this important event of inauguration of the joint meeting of the Indo-French relationship in health. We are discussing today and tomorrow, two very important aspects, cardiac and cancer, which are also two of the major killers over here. And that is timely. I, on behalf of the AIIMS, wish to thank the French delegation to have come here in spite of the colossal tragedy back home. That only speaks of the determination to defeat terrorism. In fact, you must have all heard about 26/11 in India. The same day, we had a cancer conference in Bombay. 26 started from 26/11. So naturally, the same day it had to be decided in minutes. So the Executive Council decided that we will definitely have it. Because the place where the meeting was supposed to happen, that was the next building. So some of the delegates were staying there. So, but we had the meeting. Regarding cancer, everybody knows Madame Curie. So far as the French connection is concerned, she has been a unique lady with 2 Nobel Prizes, and in the family there were 4. Her daughter got it and husband also got it. So initially the therapy of cancer used to be called radium therapy because there was nothing else except radium. For many, many years it used to be called radium therapy. So most of the therapies of radiation input, I am a radiation oncologist by profession. most of the therapies were developed. We have three techniques. We call one of them is French technique, Stockholm technique, and then the American technique. I wish to thank Professor M.C. Misra, who is our director, for agreeing with this, for agreeing to have this 2 days meeting here and supporting it from the heart and giving all the support. Dr. Jean-Marie Drew, the president of the French Academy of Medicine, deserves special thanks. He is leading the delegation, and we are extremely grateful to you, sir. Dr. Albert Claw, we especially thank you for sparing your valuable time. Mr. Bhrish Srinivas is the Deputy Director Administration. As one of the delegates just remarked, he has almost become a doctor because he knows everything now. Where even though he's a professional administrator, but he knows where exactly to pitch in and what to do. And let me tell you, he has been he has been communicating with all of us for the nitty-gritties of this conference. We used to thank the entire French delegation, our faculty colleagues, the staff, and the delegates who have come here to attend this meeting. Thank you very much.
Thank you, sir. I now request Professor M.C. Mishra, Director AIIMS, to present the AIIMS Institutional Memento to Mr. Jo Mahidogo, Président Ambassadeur de l'Académie de Médecine, please. Thank you, sir. Now we'll be starting the academic session, and I request all the dignitaries to kindly take their seats in the front row of the auditorium, please. Good morning, ladies and gentlemen. The Wi-Fi has been switched on. We'll be starting the first session in 5 minutes. We are just setting the stage. Thank you. ladies and gentlemen, on behalf of the All India Institute of Medical Sciences, I welcome you all to the first plenary session of Health Forum on Indo-French relations in health. The chairpersons for this session are Professor Andre Loho Pahodi, Honorary President ANM, and Mr. V. Srinivas, Deputy Director AIIMS. I request Professor Andre Loho Pahodi, Honorary President ANM, and Mr. V. Srinivas, Deputy Director AIIMS, to please come on the stage. I request Mr. V. Srinivas, Deputy Director AIIMS, to please come on the stage. Thank you, sir. Sir, would you like to give the opening remarks?
Thank you. Authorities, dear Dr. Jean-Marie Dru, président de la Fondation de l'Académie nationale de médecine, dear Professor Misra, Director of All India Institute of Medical Science, representative of the French Embassy in India, dear colleagues, ladies and gentlemen. It is an honor and a privilege for me to chair the first plenary session of this first AIIMS-FAM Public Health and Medical Innovation Forum. On behalf of the French National Academy of Medicine, as Honorary President, I thank the organizing committee of the forum for this initiative, strengthening the relation between the medical institutions of our two countries and especially allowing most of us to know more about the prestigious All India Institute of Medical Sciences. I am very confident the goal of this meeting will be fully achieved. Thank you very much.
Sir, would you be giving the opening remarks?
The first plenary session on the Indo-French relations in health, what the Ministry of External Affairs has communicated to us has been to formulate a protocol which can be taken forward in the form of a memorandum of understanding based on research work, academic work, and possible areas of collaboration with regard to strategic and practical challenges, and also in terms of hospital administration. So we do have three speakers from India. Professor Subrata Acharya with regard to the research work being done in AIIMS, Professor Balram Iron with regard to the work being done in the academic cooperation that is possible, and on the hospital cooperation projects. We do look forward to building up a roadmap following these discussions. Thank you.
Thank you, sir. The first speaker for this session is Dr. Mukesh Kumar, Director, CIFIPRA, who will be speaking on Indo-French Research Cooperation in Health. Now, may I call upon Dr. Mukesh for the presentation, please?
Good morning, everybody. At the outset, I, on behalf of CIFIPRA, would also like to
convey our deepest condolences for the people who have lost their life in Paris, and we also offer prayer for those who are wounded. With this, I would start my talk. Professor M.C. Misra, Director, All India Institute of Medical Sciences, Dr. Jean-Marie Drew, President, FAM, Dr. Albert Claw, DCM in French Embassy, Professor Rath, Mr. Srinivas, Professor Andre Laurent Parodi, all faculty members here, researchers, scientists, academicians, students, invitees, guests. It is indeed a great pleasure and honor for me to be here with you and will be speaking from here. First time at this place in my new position as the Director of Indo-French Center for Promotion of Advanced Research. I would like to give you a snapshot about CIFIPRA and its involvement in promotion of health research, medical sciences for the last 28 years. So this is the Center Franco-Indian pour la Promotion de la Recherche Avancée, or Indo-French Center for Promotion of Advanced Research. It's a unique platform which has been provided by two governments, Government of India and Government of France. And this was decided long back, in fact 1979, and then there was a recommendation in 1982, that a center is needed based on growing interest in medical sciences, science and technology, physics, chemistry, applied sciences, and all areas under the science and technology, that there is a need for a dedicated center by two governments. So therefore, this center was created in 1987. The first governing body of this center met in 1987, and since then the center has progressed a lot, has brought scientists from both the countries together, has provided platform for the researchers, students, postdocs, in all areas of science and technology. And in the next slide, I would like to briefly give you an introduction of the center. As I said, it is an autonomous body, autonomous agency. It works as a catalyst, works as an enabler, as a facilitator for promotion of collaborative research between India and France in cutting edge of areas, science and technology, through research projects, through seminar, workshop, mobility, and encouraging public-private partnerships. It receives financial support from the Government of India through Ministry of Science and Technology, Department of Science and Technology, and from France, the matching grant, which is provided by the Ministry of Foreign Affairs and International Development, Government of France. and this center is guided by a governing body consisting of Indian and French members, 5 each from each side, nominated by the government, two governments. And the governing body is assisted by the Scientific Council, which has the membership from India and France. There are 5 members from India, 5 members from France, and also for developing and encouraging industrial collaboration, industrial research, academic research, and industry research collaboration. There is a committee which is called IRC, Industrial Research Committee, which again consists of illustrious scientists as members of their with long experience of association with Indian and French institutes. So this is how this center is functioning and getting guidance and supervision from scientists from both the countries. And by and large, if you look at the areas of collaboration of this center, you have all the areas, almost all the areas covered under science and technology. And life and health sciences is another one of the areas under which the collaboration in health research, medical science is promoted by this center. So at the end of this slide, you have all areas covered under science and technology, so in advanced areas of science. Now, as we know that innovation is the most celebrated outcome of any research in science and technology. So CIFIPRA operates several programs related to industrial research, innovation, as well as the basic and applied research. Now we have, in summary, through this slide, I would like to tell you, and I will focus those areas or those programs which support health research collaboration. Now, under the targeted programs, the DST, Government of India, Ministry of Science, under Ministry of Science and Technology has signed few agreements with various agencies in France, like DST INRIA, DST INRA, and DST ANR. INRIA is mainly for computer science, INRA is mainly for agriculture science, but ANR, which is called National Research Agency in France, the agreement was signed by DST in 2012. And under this mechanism, there are calls which are launched periodically. And the first call launched by this was in infectious diseases. And the second call, which was launched last year, was in neurosciences. So under this program, DST-ANR, the many collaborative research programs are going on, many collaborative projects are going on in various areas of medical sciences, and these areas for every call are decided mutually between DST and ANR. Similarly, we have many other programs like CIFIPRA SOLI. It's a training program for postdocs in different areas in synchrotron. There are many programs for innovation, developing public-private partnership, and in this, you would find that CIFIPRA is playing two roles. One, as a CIFIPRA as a partner. If you look at the right side of your slide, where the CIFIPRA has signed an agreement with various agencies in France. So SGRI and Airbus, of course, these are not in the areas of medical sciences, but where the CIFIPRA is a facilitator, where BIREC under the Department of Biotechnology and BPI France, a public funded bank in France, they have signed an agreement where CIFIPRA is facilitating. So therefore, I would like to stress upon this one program, BIREC's BPI France, as well as BIREC French Embassy, in next slide. because it has the collaboration under these programs for medical sciences and health research areas. Now, I will show you that slide later on, but before that, what we have done, what CIFIPRA has done in last 28 years. It has supported collaborative research projects, 477 collaborative research projects, which are undertaken jointly by the scientists in India and France. An average duration of a project is 3 years. Cut-off dates are decided. By every April 1st and October 1st, the investigators do submit proposals in all areas. They can submit proposals to CIFIPRA in collaboration with their partner in France. In the next slide, I will tell you that out of these 477, how many were in biomedical science or health science or medical field. Industrial research project, because this program was started very late, so there are only 26 projects which have been supported so far. Publications, out of these projects, 1,747 publications, and out of this, more than 25% or the 30% were in life and health sciences, including biotechnology. Citation we have received for approximately from the source Web of Science, approximately 30,000. If you look at the output of this result, these efforts by CIFIPRA, because these are joint efforts by India and France, 143 processes, 27 designs, 22 patents, 18 patents and 22 products have been developed through collaborative research program. Mobility of scientists and students, more than 3,000. Human resource trained, 2,500. Various kind of fellowships for PhD students, for postdoc students, and these are all advertised. I would urge everybody present here to kindly see the available information on CIFIPRA website or look for advertisement, and whenever you want to develop something or you want to undertake, depending on the area of interest or depending on the area of the call, these things are available. Seminar workshops, 135 seminar workshops have been supported by CIFIPRA. Out of these, 10% were in health and life sciences, and in fact, the last one was organized very much in this institute, All India Institute of Medical Sciences and Neurosciences, by the Department of Neurosciences in October last week. Through this mechanism, through these efforts of the two governments, 143 approximately institutes in India and 62 and more institutes in France are working together or have worked together in different areas of science and technology. A new program, the Raman Charpak Fellowship, the two Nobel laureates in physics. This fellowship was started in 2013. Doesn't mean that it is only for physics, because there are many scientists, students, the PhD students are availing these fellowships. So because this started only in 2013. So out of 59 fellowships which were granted, and this is again the joint effort by the Ministry of Science and Technology through DST and French Embassy here in New Delhi, and it is coordinated by the CIFIPRA. So out of 59, the 15 fellowships were in the life and medical sciences. Now the first one, the how many collaborative research projects. So if you look at the number, though the seminar and workshop which were supported by CIFIPRA were only 10% in life sciences or medical field, but the projects emanated from the scientists either through these workshops or the platform provided by CIFIPRA, but 25% of the projects, so the total projects which have been supported by CIFIPRA were in life and health sciences. So, huge, a big opportunity which has been availed by scientists in this area in both the countries. Public-private partnership in health. As I was saying in the beginning in one of my slides, that I would like to stress upon these two programs which have various areas from medical sciences or health research. These are the two programs. The first program was formulated in 2014 between French Embassy and BIREC, because for these two programs, CIFIPRA is a facilitator. The money is provided by these agencies and a joint call for mechanism is adopted. So for 2+2 scheme involving one academic institute associated with industry from both countries, it's a requirement. So funding of two promising projects last year were supported for the development of new diagnostic tools for cardiovascular diseases under first call. And the second call is on these days because this was launched on 15th of October. And the areas which are listed out here, you can go to CIFIPRA website and you can find out, and the last date under this call is 15th of January next year. Similarly, the second program, which was initiated very recently, this year only, which is with BPI France, as I said, the public funded bank there, and BIREC, under the Department of Biotechnology, the joint call was first one was launched early this year, and the second one has been launched last Monday on 16th of November, and the last date is February 15th next year. So these are the areas for the second call: e-health, telecare, health IT, M-health. All these areas are included because it is supposed to be a public-private partnership in health. So therefore, there is a requirement for an industry in your project. There are several outcomes which have been highlighted in various reports. So in health sciences, there are several studies which have been conducted by with the joint efforts of scientists in both the countries. Again, the misoprostol, which was in fact produced by a company in public. I'm just giving you an example that the drug which is recommended by WHO as an essential drug for anti-fertility programs. So with the help of CIFIPRA, or with the support of CIFIPRA, the University of Rennes in France, IICT, a CSIR institute in Hyderabad, they worked for 3 years and they came out with a synthetic route of the compound, and then with the help of Evra Limited India, based in Hyderabad, they developed or they produced the drug which is inexpensive, affordable healthcare product, and the cost was brought down. So this is an example of CIFIPRA supported public-private partnership project. And other than CIFIPRA, there are several other programs which are going on for biomedical research. There are, in the country, there are 14 joint labs in various areas of science and technology. Out of these 14 labs, 5 labs are in the field of biomedical sciences. I will show you where are these labs and what are these labs are doing there. And in the last summit, the Tech Summit, which was held in India in October 2013, there were 4 round tables in biomedical sciences or for medical research. In the areas of neurosciences, infectious diseases, cardiovascular and metabolic diseases, and computational biology. So this area is very, very important for both the countries. Another program which I was coordinating till a month ago, which was ICMR Inserum program. This agreement was signed in 1989 and renewed in 2000 for various areas of medical research. There have been 8 scientific seminars, 31 projects have been funded. Mobility of students, researchers has been part of these collaborative programs in ICMR, and number of joint publications have come out, several PhDs have been completed. In fact, this is a program where if we map the outcome of these activities, then collaboration has led to transfer of technologies, patents, new knowledge, improved tools and techniques, development of biobank. In fact, the first Cotutel, this is the joint PhD, which also came out as a project between University of Paris and Gipner Pondicherry. So this was again an outcome of this collaborative programs which is also going on. Capacity building, LIA, which is the joint lab, one of the 5 labs came out as a result of this collaboration. And this has definitely provided greater opportunities for the scientific community in both the countries. Now, if you look at the 14 joint laboratories, which is called International Associated Lab or LIA in French language, these are the 14 labs, and out of these 14 labs, the 5 labs are in medical sciences. Those are in orange color, like you have one in Bombay, which is ICMR Institute, one in Bangalore in neurosciences, another in Bhubaneswar Institute of Life Sciences, joint lab in infectious diseases, one is in joint lab in liver diseases in Basant Kuj with Dr. Sareen there, and in Bangalore one more you have in system biology. So yeah, this is the list of these labs.
2 minutes more, please.
That's the last slide.
2 minutes more.
So overall gain, if you look at the overall gain, the India-France collaboration has helped the scientists of both the countries to develop collaborative links in the areas of health sciences. It has made research more competitive, achieved fruitful results, which is evident from the kind of manpower, the trained manpower we have in labs in both the countries. As I said, the technology transfer, publications, PhDs. In fact, number of researchers or number of investigators are from this institute who have been actively working for Indo-French collaboration. Greater interaction and greater opportunities which was provided for Indo-French collaboration by different mechanisms which are available. With this, I thank you very much for patience hearing, and thank you for giving me this opportunity here. Thank you very much.
The mic is in the center, sir.
Please introduce yourself and then a brief question.
I want to know whether there is any, my name is Dr. Francis Das. I want to know whether there is any collaboration considering that the Aurobindo Ashram in Pondicherry is a hub center for spiritual issues. Will CEFIPRA be involved in such programs where psycho-spiritual issues can be discussed in psychosomatic medicine also to provide a better cooperation with the French?
There is no restriction in this any particular area, because as I said, any area in life and health sciences can be taken up by CEFIPRA. In case you have identified your collaborator in France and there is an interest in your collaboration, as I told you, there are two deadlines, April 1st and October 1st. So I would encourage you or them in Pondicherry, if they are interested, they can submit their proposals. The project will be reviewed jointly on scientific merit by scientific council, and the decision is taken accordingly. This is how the center is working.
Yes, Dr. Armand from Paris Cancer Institute. Thank you for your presentation. I have one question concerning the development of new drugs. When you are in France, in the university, at the very same time you discover a target, you develop a drug to control a disease. And we have a good collaboration with Indian biotechs, which are very, very clever. And my question concerns the patent of those results. How do you consider this type of collaboration when France is using the patent system to cover the result of the university when it's not so evident for India?
Very recently, in 2014, jointly India and France, they have come out with a patent policy under the collaboration under CEFIPRA mechanism. This patent policy is available there on the website of CEFIPRA, and the IP management plan is signed jointly before starting of the project, because this program is covered under the IRC, Industrial Research Committee of CEFIPRA, which was started in 2002, and a new dimension has been given only in 2014, and that IP policy is well defined. IP management plan has to be signed. So I would urge you to kindly go through it, because there are, if I say 26 projects have been completed, means they all have signed the IP plan and all are with France and French universities.
Thank you. Thank you. We have to cut now.
Thank you, sir. The second speaker, Professor Subrata Acharya, Dean Research AIIMS, will be enlightening us on development of research centers in India. Now, may I please call upon Professor Subrata Acharya, Dean Research AIIMS, on the dais, please.
Good morning, ladies and gentlemen. Good morning, Chairperson, sir. Good morning, dignitaries from French Academy of Medicine and France, and my senior colleagues, our Director and Dean. Well, I will highlight the research at All India Institute of Medical Sciences, and that was my job. Indeed, the Director in his directorial speech has given you some introduction about it. Now, in 1956, All India Institute was established by an Act of Parliament. That was just after independence. And a part of nation building, the Government of India established many educational institutes, and AIIMS was one of them. During that time, our primary thirst was education, because we wanted to train teachers for the whole country, which we have fulfilled very well during the 60 years. But gradually we established almost all of state-of-the-art services in this institute, making it a university hospital as well as outstanding teaching institutions. And by now, It has become a brand name in patient care. During last 3 decades, as our patient care improved, our education improved, our faculty got engaged in active biomedical research, and during last 3 decades, research has become a thirst area for All India Institute of Medical Sciences. Now, this is the essential governing functions which director has given it. Now, we have by now about 52 departments. Our dean academics will give you more details about it. And at a unique time, we have more than 3,000 students in various disciplines, which include undergraduate, postgraduate, postdoctoral, and PhD programs, as well as various paramedical programs. And we have also long-term and short-term training besides this basic defined degree courses. And we have been involved in elective training from all over the world, particularly Southeast Asia, as well as from Europe. And if you can see, I have given some numbers for particular year. It is reaching almost 1,000 students who are getting trained in this institute, indicating its reach as far as education and training concerned. As a hospital, we have, as director pointed out, 2,500 inpatients bed. And if you see, in the year 2012-13, we saw about 3 million people in the OPD, outpatients, admitted more than 200,000 patients, performed more than about 150,000 interventions, including surgical interventions. And as director pointed out, we have been rated as one of the best medical education, best medical university for teaching, for services, as well as for research, not only in this country, as well as our Asia Pacific region. Also, we have established our brand name globally. Now, research has become our thirst area where I wanted to briefly outline our activity. If you see, we have both research actively pursued by our faculty as well as our students, and the funding comes from extramural research grant as well as intramural research. I've given you the simple example that during last year, we have about more than 500 projects, which is about 70 crore Indian rupees, that is 700 million Indian rupees. And we get funding agency from this country as well as from international funding agency. And we have collaborative project almost from all of the Europe, USA, as well as in Southeast Asian country. Now, if you see, this is progressively year-wise, our funds are increasing as our faculty number is increasing, and more faculties are actively getting involved in the research. We have started giving our young faculty intramural research grant ourselves. And if you see, last year we have given almost 150 intramural research grant to our young faculty to incentivize the research in this institute. And this is actually helping a lot of people. This is a extramural research grant which is progressively increasing from our extramural funding agencies inside the country, like Department of Biotechnology, Department of Science and Technology, Council of Scientific and Industrial Research, Indian Council of Medical Research, Ministry of Health, Ministry of Social Welfare, and various other nodal agencies. We are also involved in industry-sponsored research programs and with various industry partners, and I am showing you the funding also available from very industry sources, which is about more than 1 crore in a year. That's what I saw. We have also international funding agency from which we have various collaboration, and I've just projected the funds from international collaboration. Now, if you see in this country, there are certain institutions which is rated by independent organization at the highest scientific output with high impact. In fact, Government of India, Department of Science Technology divides this institute 3: high output and high impact, high output, low impact, and low output, low impact. These are high output, high impact institute. And if you see, most of this is Indian Institute of Science, which is rated as one of the best institute in the country, which has been included amongst the top 100 best institute in the world. And we just follow them as far as the research output is concerned. And we have produced but done much better than many of the basic institutes whose basic job is to do research and teaching. And we are a hospital, as I told, we see 10 million people. We saw about 3 million people in a year, about 7 to 10,000 patients in OPD with 2,500 inpatients. And despite that, the faculty of the institute is actively engaged in research, and the output showed the result. We had contributed certain very seminal contribution in the research. We have just briefly mentioned, because malnutrition was a problem in this country initially, and we indeed identified various micronutrients as responsible for various respiratory tract infection and diarrheal diseases in this country. And we had defined various epidemiology of non-communicable diseases in this country, which has formed the basis for policy making for these diseases. We have been also contributed tremendously for various vaccines, various etiology of diarrheal diseases and treatment. Liver diseases, the contribution is seminal. We describe many new entities which are inherent or endemic in this country, like Indian childhood cirrhosis, non-cirrhotic photofibrosis, were described first time from this institute. This disease were not known or recognized. Similarly, on acute liver failure or hepatitis C and E, we have developed our own kits, our own diagnostic, our own models and own therapy. And in tuberculosis, actually this institute has been identified, devised the strategy to control tuberculosis for the whole region, and there are many patents on diagnostic and monitoring of tuberculosis already identified from this institute. Many faculties are very actively involved in tuberculosis research. And on malaria, we have contributed seminal research leading to many awards, which are prestigious awards in this country. And on vaccines like rotavirus and HPV vaccines, there are a lot of work going on. This is a very important area, and this research has led to influence our policy making in this country. One of the important policy making program, Integrated Child Development Services, which actually I was very involved since beginning, because my chief then was the chairman of Central Technical Committee of ICDS, which started in this campus. And this became a national program which provides a combination of care of malnutrition, immunization, safe pregnancy, as well informal education and nutrition in children below 5 years, a program which was started in this institute. Many people will not know, in this campus it was started by one of the faculty, which gradually became a national program, had become very important national program. Similarly, one of the directors of this institute, Professor Swami, and many of his active colleagues who are working in this institute, identified that iodine deficiency is causing cretinism as well as hypothyroidism in a large segment of population in this country. And the policy of iodinization salt was discovered. National Blindness Control Program, Fluorosis Control Program, Tobacco Control Program, National Care for Aging, whole hepatitis B and A vaccination policies based on evidence, as well as developing of hepatitis C virus kits and testing in our blood bank, and many other. And now the trauma is a lead, as a leader in our research area and influencing policy making, has been remarkable, and it has changed people's life in this country. Our publications is last year, about 2012, is gradually increasing and reaching almost 1700 per year, with similar number of chapters and book. If you see, this is the Web of Science information, and if you see about more than about 1200 original research articles in peer-reviewed journals are produced, and this is Web of Science, which is showing gradually increasing publication numbers from these institutes. And the citation, if you see by 2014, our citation is reaching almost more than 100,000 by now. And remember, institute, even though it was established in 1956, we took about 10 to 15 years to establish the infrastructure in this country, and this more than about 11,000 citation has come probably from 1970s and late 70s. We started picking up. So during these 3 decades, we have this large number of citation, and the citation is gradually increasing. If you see, and these are all web of science informations, so we have not used the citation, this is international citation. Our faculty has many patents, and the patent cell was started only recently during last 3 to 5 years. We didn't have patent cell, proper organized patent execution, but now we have. And if you see the patent, number of patents were just listed is gradually increasing in progressive manner. We have an innovation center, Dr. Balram Bhargav is sitting, who started the Stanford AIIMS Biodesign Center, which is making, this is a third focus, developing innovations, because many of the instruments used in life sciences we are importing, and as Dr. Bhargav pointed out, given a term that frugal investment to innovate for simple technology to be implemented in large population in this country is essential, and by now probably they have patented more than 13 innovated patents, and there are many young people are taking up startup ventures, establishing industries. From these centers we have already established, and now it is called an International Biodesign Center. I personally is involved in development with Dr. Bhargav and some people, liver biopsy needle, which is wonderful, probably is one of the best liver biopsy needle that has been developed in my experience, and many other innovations. And these are various subject-wise. There are certain departments which has done outstandingly well, which according to the Web of Science, which I have pointed out.
Ceci est donc une particularité, on va dire, parisienne et française. Vous imaginez qu'il y a également de la recherche à l'assistance publique, beaucoup de recherche, beaucoup d'innovation, je ne vais pas toutes les détailler. Le premier bébé éprouvette est né à l'assistance publique. Il y a beaucoup de recherche en chirurgie, avec par exemple des transplantations multiples. Le premier cœur artificiel totalement implantable a été implanté dans cette structure. Le système d'histocompatibilité humaine a été découvert à l'assistance publique. Je ne vais pas détailler, je laisserai une petite brochure pour ceux qui sont intéressés par l'ensemble des domaines de recherche qui sont grands et qui sont totalement multidisciplinaires dans cette structure. Ceci aboutit évidemment à un grand nombre de publications scientifiques qui sont ici répertoriées. L'assistance publique fait partie des 5 plus grands systèmes de publication, enfin propose des publications dans le monde. Et bien évidemment, l'assistance publique est partie prenante et extrêmement intéressée par le développement de collaboration. Collaboration avec les professionnels de santé, qu'ils soient médecins, qu'ils soient paramédicaux, qu'ils soient techniciens ou qu'ils soient administratifs, directeurs. Bien évidemment, cet échange s'intéresse à la fois sur les aspects techniques, médicaux et paramédicaux, mais également sur les bonnes pratiques et le management des hôpitaux et l'expertise de qualité. Elle est bien également intéressée par, bien sûr, intéressée par des programmes d'échange de formation et des programmes de recherche, basic research ou clinical research. Et vous voyez ici les centres, on va dire, les plus marquants de collaboration qu'a l'assistance publique à travers le monde. Et en Inde, je vais vous en parler juste après, il y a une collaboration tout à fait intéressante qui a été établie depuis 7 ans avec l'hôpital public Jipmer de Pondichéry. Je vous remercie pour votre attention. Je suis bien sûr à votre disposition pour répondre aux questions.
Merci professeur Henry, merci beaucoup. Donc nous avons du temps pour quelques questions. We have time for any question, please. Pas de questions. Pas de questions.
Maybe I can move to show the collaboration that we have with Pondichéry.
There is one question. Do you have a question?
Yeah, well.
So my question is that with increasing life expectancies, there is always the need for transferring the patients to to the community. And there is need for community care-based hospices also. Now I want to know how, first question is how this is going to be done, how much will the APHP or the Greater Paris University Hospitals gain from our experience in India vis-a-vis our slums and Parisian slums?
Very good question. Maybe the following presentation could answer to this question, because maybe we can have this question after the next presentation, because there is some answer in the next presentation. Okay, I will move to the next presentation now. Donc, excusez-moi pour le... I will move into French, one time more. Donc, je vais vous présenter la collaboration que nous avons établie avec l'hôpital Jipmer à Pondichéry. Juste quelques mots concernant cette collaboration. Cette collaboration a débuté en 2009, elle dure depuis 7 ans. Nous avons fait 7 workshops à Pondichéry. Ont participé à ces workshops 178 cardiologues interventionnels, 15 médecins spécialisés en médecine d'urgence, 96 infirmières. Ceci a généré 55 billets Paris-Chennai, Paris, 175 nuits d'hôtel, la donation de plus de 500 stents, qui sont des systèmes de dilatation dont je vais vous parler juste après, et également un psychiatre qui s'est peut-être perdu dans cette collaboration. Alors, cette collaboration s'est faite donc entre un grand hôpital public du sud de l'Inde, situé donc à Pondichéry, près de Chennai, l'hôpital Jipmer, dont vous avez ici quelques photos. Cette collaboration non seulement s'est intéressée à cet hôpital universitaire Jipmer, mais également un hôpital du centre de Pondichéry, public également, qui est de Indira Gandhi Government General Hospital, IGGGH, donc c'est un hôpital plus petit dans lequel il y a également un service de cardiologie. L'autre partie de la collaboration était faite donc en France, par un des hôpitaux de l'assistance publique dont je viens de vous parler. Il s'agit de l'hôpital Lariboisière, qui est un hôpital qui est situé au nord de Paris, nord de la Seine, qui est un hôpital qui est situé très près du quartier indien à Paris. Il s'agit d'un hôpital public universitaire qui a une activité extrêmement importante d'urgence, mais également de cardiologie, de neurologie, les maladies ostéo-articulaires. Vous voyez ici quelques photos de cet hôpital. La collaboration a débuté par un médecin cardiologue français dont le père était né à Pondichéry, mais qui a fait ses études en France. Et cet cardiologue, le docteur Adavan, a souhaité faire 6 mois de stage de cardiologie à Pondichéry pour retrouver ses origines. Elle a pris contact, par l'intermédiaire du professeur Cribier d'ailleurs, avec le docteur Santoche, qui était le responsable de la cardiologie, qui est toujours d'ailleurs le responsable de la cardiologie dans cette unité. Elle a donc passé de 6 mois de stage à Jipmer pour finir d'apprendre la cardiologie. Et pendant ces 6 mois, elle a eu 6 mois absolument exceptionnels de collaboration, de discussion, vu des patients extrêmement intéressants. Et elle est revenue tout à fait positive, extrêmement intéressée par ce stage. Et lorsqu'elle est revenue, elle nous a fait part d'un souhait qu'avait l'équipe de cardiologie locale à Jipmer, qui était de développer la voie d'abord radiale pour les interventions coronaires. Je vais vous expliquer de quoi il s'agit. Vous savez qu'une des causes majeures de mortalité est l'infarctus du myocarde. Et l'infarctus correspond à l'occlusion d'une artère coronaire qui amène du sang au niveau du cœur, et qu'il est tout à fait possible, et même largement possible depuis maintenant plusieurs années, d'aller dilater ces artères pour les rouvrir en utilisant des petits ballons ou en utilisant des coquillages que l'on met à l'intérieur des artères qui s'appellent des stents. Alors pour faire ces dilatations, il est absolument nécessaire de rentrer à l'intérieur des artères. Et pour rentrer à l'intérieur des artères, on a deux voies. Une première est d'abord fémorale, au niveau du pli de l'aine, et la deuxième est la voie d'abord radiale. La voie d'abord fémorale a été utilisée pendant très très longtemps comme voie d'abord principale, car il s'agit d'une très grosse artère. Mais depuis environ une quinzaine d'années, tout d'abord les Français, puis l'ensemble de l'Europe, a passé sur une autre voie d'abord, qui est donc la voie d'abord radiale au niveau du poignet, qui est une artère plus petite, qui est plus compliquée à fonctionner, mais qui présente un intérêt majeur. C'est le fait qu'elle ne provoque pas de saignement, en tout cas des saignements qui sont très faciles à contrôler. Et donc elle permet de faire des procédures avec des durées de séjour plus courtes. L'équipe indienne a donc souhaité collaborer sur cette thématique et nous sommes venus faire ce premier workshop en 2009 pour partager notre expérience sur cette voie d'abord radiale. Comme cette première collaboration s'est très bien passée, nous avons enchaîné sur une collaboration chaque année où nous venions à Pondichéry, à l'hôpital Gitmer, travailler sur la deuxième année, la dilatation, l'angioplastie coronaire par cette voie, avec des approches de plus en plus complexes, de plus en plus larges, avec des techniques de dernière génération, de l'imagerie de dernière génération, et enfin sur la prise en charge des urgences coronaires, qui est encore un secteur, on va dire, particulier. Chaque année, nous sommes donc venus pour collaborer avec nos amis indiens sur chacune de ces thématiques. Voici le dernier workshop. Le nom de workshop s'appelle IFRIC, Indo-French Radial Intervention Course. À partir de 2013, il faut savoir qu'à l'hôpital Lariboisière, où je suis responsable d'un pôle. Un pôle est un regroupement plus large de services hospitaliers. Et dans ce pôle coexistent plusieurs services, la cardiologie, mais également les services d'urgence et les services de réanimation médicale et chirurgicale. Et il nous a paru intéressant d'essayer d'étendre cette collaboration qui avait démarré sur la cardiologie à autre chose. Et il est apparu en discutant avec nos collègues indiens qu'une extension sur la médecine d'urgence pourrait être extrêmement intéressante. L'idée étant de faire un lien, premier lien, entre les urgences et la cardiologie pour essayer de créer un réseau de prise en charge et pas s'intéresser seulement à un service. Donc à partir de 2014, en 2014 et en 2015, en plus de l'équipe de cardiologie, est venue une équipe de médecine d'urgence avec un professeur de médecine d'urgence, le professeur Patrick Plaisance, 5 spécialistes sur les 2 ans en médecine d'urgence et 4 infirmières sur les 2 ans. Plusieurs éléments ont été abordés pendant ces workshops sur médecine d'urgence. L'organisation générale et le triage des patients, la première année, le triage avancé et des thématiques comme la ventilation non invasive et l'échographie d'urgence, pulmonaire et cardiaque ont été abordés en 2015. Ce qui est intéressant de voir, c'est que les médecins urgentistes à Gitmer étaient un petit peu balancés entre 2 façons de voir leur métier. Le premier était, est-ce que les médecins urgentistes sont de simples ponts entre l'extérieur et les spécialités, et donc ils n'ont qu'un rôle de redirection des patients, ou est-ce que les médecins urgentistes ont un vrai rôle, sont une vraie spécialité par elles-mêmes, et c'est ce que pensent les médecins urgentistes français, c'est-à-dire qu'il s'agit d'une spécialité médicale qui est centrée sur le soin primaire, en dehors de l'hôpital, à l'intérieur de l'hôpital, avec un triage professionnel des patients et des soins spécifiques. Évidemment, les médecins urgentistes français pensent que la solution est la deuxième solution, c'est une spécialité par elle-même. Ils ont été heureux d'essayer de communiquer cette façon de voir à leurs collègues indiens. Voici un exemple du team urgence. Plusieurs autres collaborations ont été réalisées. Nous réalisons des vidéoconférences régulièrement. Plusieurs médecins indiens ont fait des stages en France jusqu'à 2 mois. Nous avons impliqué également les directeurs des groupes hospitaliers. Il nous paraissait important que, et je vais en parler juste après, qu'il s'agisse d'un team. Il y a des étudiants en médecine qui sont venus, 25 étudiants sur 7 ans sont venus faire 1 mois de stage à Jipmer. Et nous avons également des liens tout à fait privilégiés avec le consul de France et l'ambassade de France lors de ces missions. Alors, quelles sont les bases pour terminer de cette collaboration? La première base, et ces bases, on les a définies ensemble avec nos collègues indiens. L'idée n'était pas de montrer pour les Français, mais de partager. Et ceci est extrêmement important. Nous ne faisions pas les procédures à leur place, on les faisait ensemble. Le deuxième élément, c'est que cette collaboration impliquait l'ensemble de l'équipe. Ce n'est pas une histoire uniquement de docteurs, c'est aussi une histoire d'infirmières, voire de directeurs hospitaliers. Donc c'est un groupe qui fait force de proposition et force de collaboration. Et c'est extrêmement important pour garder de l'énergie pour continuer. Enfin, nous avions une devise dans cette collaboration, c'est que chaque année, il fallait faire plus que l'année précédente. Et c'est ce qui nous a permis de continuer cette collaboration également. Je ne vais pas détailler les objectifs qu'il y a eu et qu'il y a encore à la fois dans les parties cardiologiques à gauche et dans la partie urgence à droite. Ces objectifs sont multiples, simplement pour vous rappeler que bien évidemment, il y a des objectifs techniques, mais il y a également des objectifs de qualité, d'organisation et de prévention des risques qui sont pour nous extrêmement importants. Et c'est la raison pour laquelle les infirmières doivent venir et les directeurs doivent venir aussi. Bien sûr, il y a des problèmes financiers dans ce genre de collaboration. Les voyages de l'équipe française, généralement, ont été faits par l'industrie française qui payait les voyages, puis par une grante du ministère français de la Santé en 2015 et pour 2016. Il y a eu beaucoup de donations des industries indiennes pour ce workshop et le logement a été fait d'abord de façon tout à fait locale, puis avec une aide de l'hôpital Jipmer. Quel est le retour? Pour terminer, le retour de cette expérience au niveau indien, ce n'est pas moi qui parle, c'est mes collègues indiens. C'est d'abord de la confiance, bien évidemment. Travailler ensemble, c'est plus facile. Ça permet d'avoir confiance. De la visibilité, visibilité à l'intérieur de la communauté hospitalière, en dehors de la communauté hospitalière, parce que bien évidemment les journalistes étaient impliqués dans cette opération également, mais également visibilité sur les industriels. Et il est certain que les industriels ont été beaucoup plus présents à Jipmer pour les collaborations avec les workshops. Bien évidemment, une progression dans les connaissances, dans l'expérience, dans l'organisation, je vous en parlais juste dans un instant, et dans la recherche. Alors voilà par exemple un des impacts de cette collaboration au niveau cardiologique. En 2008, toutes les explorations étaient faites par voie fémorale. En 2015, elles sont toutes faites par voie radiale. Actuellement, il faut savoir que la voie radiale est la voie recommandée par les recommandations. Toutes les angiographies étaient hospitalisées. Maintenant, 95% en Inde sont faites de façon ambulatoire. Le nombre de patients explorés est passé de 5 par jour à 25 par jour. Il faut dire qu'il y a eu également une augmentation du nombre de cath labs qui est passé de 1 cath lab à 3 cath labs. 100% des angioplasties étaient hospitalisées. Maintenant, 15% sont faites en ambulatoire. Les patients ressortent le soir. Et on voit également une diminution considérable de la durée moyenne d'hospitalisation avec un nombre de lits donc, qui n'a pas bougé. Donc on a vraiment une optimisation des ressources. Et ceci a permis de créer des publications par l'équipe indienne sur cette expérience d'angioplastie ambulatoire. Au niveau français, j'irai très vite, le retour est excellent, beaucoup d'enthousiasme de la part des équipes. Ceci a permis beaucoup de cohésion et de dynamisme dans les équipes françaises. C'était exceptionnel de partager et de discuter avec nos amis indiens. Ça nous a permis également d'aller plus loin parce que finalement, à un moment donné, ils allaient plus vite que nous et donc on a essayé d'aller aussi vite qu'eux. Bien évidemment, nous avons traité des patients différents et le recrutement est différent en Inde. Nous avons été fiers de mettre en avant l'expérience française et l'expérience de la PHP. Nous avons des thématiques de recherche en cours et pour nous, c'est important également de parler anglais. Voici des collaborations que nous avons pu avoir à travers toute l'Inde, à travers ces workshops, dont un, par exemple, à Delhi. Dans le futur, très clairement, nous allons pousser pour que la médecine d'urgence progresse. Alors en cardiologie, nous avons continué la progression en essayant de répondre à la maxime européenne, qui est de dire que tout infarctus doit être traité par angioplastie. Ça s'appelle Stand for Life. Mais le push va venir de la médecine des urgentistes, dans lequel il y a encore beaucoup de collaboration à faire. Une extension possible au niveau des traumas, qui sont la même division en France. Et également l'extension en dehors de l'hôpital, puisque ce qui est intéressant, c'est peut-être de travailler sur la prise en charge globale du patient, de chez lui jusqu'à l'intérieur de l'hôpital. Et ceci nécessite beaucoup d'organisation. Bien évidemment, le futur, c'est faire plus de recherche, de faire venir plus de collaborateurs indiens en France et de continuer à trouver de l'argent pour ces collaborations. Voilà, par exemple, pour l'Emergency Team, l'objectif est de travailler l'année prochaine sur les douleurs thoraciques, le triage, et en 2017 sur le soin en amont des urgences, de façon à essayer de faire un réseau de prise en charge pour les patients. Je voudrais terminer, si j'ai encore 10 secondes, par remercier mes collaborateurs indiens. Le premier est le professeur Santosh, qui est le chef de service de JIPMER. Et j'ai trouvé cette maxime de Gandhi, qui s'applique, je trouve, très très bien à lui. Il a été d'un dynamisme formidable et il n'aurait pas été là, la collaboration n'aurait pas eu lieu. Le professeur Balachander, qui est actuellement super médical à JIPMER et a initié cette collaboration. Le docteur Manimaram, qui est dans l'autre hôpital, le petit hôpital du centre, dans lequel nous avons eu des rapports également extrêmement intéressants, et avec lequel nous collaborons beaucoup. Notre infirmière, parce que ce team est un team non seulement de docteurs, mais également d'infirmières. C'est également un team avec l'industrie, c'est le premier industriel, laboratoire Terumo, qui a permis le premier déplacement, le premier voyage. Mais également mon ami le docteur Karthikeyan, qui est à AIIMS, avec lequel nous avons beaucoup de collaboration, plutôt en recherche de cardiologie. Et pour terminer, les urgentistes, le chef de service des urgences de JIPMER et le professeur Plaisance, le chef de service des urgences de la Rivoisière. Je remercie également le support des autorités françaises, avec le consul de France qui a toujours été extrêmement prévenant, attentif et présent, et l'ambassade de France, notamment à travers M. Aretz, qui était là aujourd'hui, qui nous a beaucoup aidés. Je vous remercie.
Merci, professeur Henry. Je prie d'excuser, je crois qu'on va devoir continuer, mais on pourra revenir peut-être en fin de meeting sur ces collaborations tout à fait passionnantes. Merci beaucoup.
We are open for the question and answer session. If there are no questions, we'll start the presentation. The last speaker of this session is Professor D.K. Sharma, Medical Superintendent AIIMS, who will be presenting a talk on Hospital Corporation Prospects. I request Professor D.K. Sharma to come on stage and deliver his talk, please.
Good morning. Once again, I would welcome you all to the first AIIMS-FAM Public Health and Medical Innovation Forum. I will now be public-private composition, regulatory frameworks, and policy priorities. But several factors make the healthcare sector area conducive to expanding bilateral hospitals cooperation between the two nations. The India and European Union Trade and Investment Agreement, TIA, is of definite significance given that it is India's first agreement with a major developed country bloc. It is imperative to mention here that recently World Health Organization has ranked the French healthcare system as the best in the entire world, and I would attempt to view the same through the collaborative lens. All India Institute of Medical Sciences is the premier public sector tertiary care referral hospital in India, and to consider the collaborative process, AIIMS need to be understood through its trinity of mission within the overall context of Indian healthcare system. What is this trinity of mission of AIIMS? These include medical education, research, and patient care. Well, over the years, AIIMS has gone through many adaptive responses to remain the premier autonomous tertiary care public sector referral hospital in our country. Now, first is medical education. As a center of excellence in medical education, AIIMS continues to be the best medical school in India. Last year, AIIMS enrolled 724 scholars in various courses, provided postgraduate training to 695 trainees, 70 WHO fellows, and observership to 63 foreign nationals. AIIMS also continues to play a significant role in nurturing and mentoring other AIIMS-like institutions established by Government of India. Second is research. In the past year, AIIMS, as the leading research institute, has conducted over 508 cutting-edge researches and published over 1800 research papers, and as we can see, this has been increasing gradually over the past few years. Our third mission is patient care, and towards this end, AIIMS is a city by itself. We have more than 2,400 beds, 52 specialties, about 2.7 million outpatients every year, 200,000 admissions, over 150,000 surgical operations. Our net death rate is 1.9%, which is comparable to best in the world. Our average length of stay is 4.8 days, and bed occupancy is a healthy 86.4%. In the country's context, AIIMS has approximately 0.2% of public hospital beds, and it consumes about 0.5% of federal health budget. The increase in annual budgetary allocation to AIIMS from US $0.6 million in 1972 to about $173 million in 2011-12 is a mirror of India's GDP increase. As regards our healthcare financing, I would like to inform you that our inpatient cost comes to around, if I convert it dollars, about $30 per day. Providing diet to each patient comes to about $1.50 per day. General surgical procedures cost an average about $700. Our ICU care costs comes to about $100 per day. And just as an example, a kidney transplant operation costs about $3,000 US. Viewed through the prism of healthcare financing, the in-payer cost that we incur is about $38 per day, whereas the patient admitted in the general ward pays only $0.6 per day. Rest is all supported by the institute through its grants. Our out-of-pocket expenditure is a matter of concern. This graph is showing source of payment of admitted patients, whereby we can see that over 75% of the people pay for their healthcare expenditures on their own, particularly procuring medicines and surgical consumables in outpatient and to some extent inpatient as well. Well, I have already said, and we all know, that French healthcare system is the best healthcare system in ranking of world's healthcare systems. At the same time, French healthcare is also becoming increasingly expensive, but it is still less costlier than US and UK. Shifting demographics over the years shows that all over the world, in all developed countries, we are having more aged and retired people. Now we can consider as to what could be possible AIIMS-French collaborative opportunities. First is technical skills. France, with its aging population, that 1 in 6 persons is over 64 years of age, and overburdened public healthcare systems could benefit from collaborating with AIIMS with its large pool of medical manpower and young population across a variety of segments. Second is clinical training. India, with its disparate population, has an entire gamut of non-communicable and communicable diseases. AIIMS, as an important referral institute with a large catchment area, provides a huge opportunity for training for residents and clinicians in these conditions. Thirdly, it is teaching and training of trainers opportunities. Faculty exchanges programs, especially pertaining to human resources, stem cell research, laboratory medicine, and cancer care could be mutually beneficial to each other. Fourth, burgeoning healthcare costs. The rising patient care costs in France continues to be a challenge. AIIMS, providing quality, affordable healthcare, could provide a few replicable lessons. Fifth possible area is that we have been providing dual healthcare delivery at AIIMS. Over the years, there has been a transformation of AIIMS into a tertiary level teaching hospital with dual healthcare roles with its inherent challenges, that is, a specialized referral hospital on one hand and a large general hospital on the other hand. AIIMS has large patient clientele, constantly pushing the envelope of quality and patient satisfaction, which is in fact an outcome of its own hallowed reputation. French collaboration may perhaps yield some solutions through joint research projects. Then there is an issue of managing change, which is essentially required owing to 1. Exponential growth of medical field propelled by cutting-edge technology and newer specialties and patient care modalities. And second, that disruptive technology and its integration within the system as a result of IT revolution is a challenge that the AIIMS is facing, being on the forefront of this transformation. France have already treaded this path and can offer us the road ahead. Next is telemedicine cooperation. AIIMS has prospects of providing assistance in many aspects of e-health, including teleradiology, telediagnostics, telepathology, tele-intensive care, ophthalmology, dermatology, psychiatry, that is using video conferencing to connect patients and psychiatrists for diagnosis, assessment, medication management, or second opinions. These prospects are driven by India's cost advantage and the quality of our radiologists and specialized technical staff. The telemedicine approach to emergency care is also a successful model being discussed. Next is social insurance. Universal health care through social health insurance, which under various schemes currently covers almost 100% of French population. Universal health coverage is also a thrust area for India, since only 11% of India populace is covered through insurance and only 0.5% of the patients admitted in AIIMS are insured. Knowledge sharing opportunity in this field is vast. Next area is regionalization and decentralization. In France, it is ARS, Agence Régionale de Santé. The regional health agency, its one-stop shop approach to healthcare. The lessons therein would help in making the Indian referral system more efficient, with a long-term effect in decongestion of AIIMS patient care services. 10th is health technology assessment. It is a field that AIIMS intends to foray into, where France is already a pioneer. Then we can consider the issue of waiting time for surgeries. Waiting time for elective procedure in AIIMS is very high because of increasing patient load. For example, average waiting time for urology, ENT and orthopedics procedures is about 44 days, whereas that for neurosurgery is about 109 days. Waiting time for elective surgeries are far shorter in France, and a study has shown that only 7% of patients waited longer than 120 days. Lastly, it is electronic medical records. France has a state-of-the-art system of personal electronic health cards. AIIMS is tentatively poised to move to an EMR system, and collaboration will track the process while providing a learning opportunity for a standalone EMR in a developing nation. Thank you for your attention.
Thank you.
Thank you, sir. Now the house is open for any question answers. Thank you. I now request Professor Andre Loho Pahaudi, Honorary President, ANM, to conclude the session.
Well, but before I think that Mr. Srinivas will give a...
I request Mr. V. Srinivas, Deputy Director AIIMS, to conclude the session.
Thank you. It's been a very interesting session, and over the last 2 hours, a number of proposals where possible areas of collaboration can be identified and incorporated into tomorrow's convention have been identified. I'll broadly list what has been identified, and student exchange programs, faculty exchange programs in stem cells, research, laboratory medicine, IVF technology centers. Also with regard to research work, some collaboration work on the central instrumentation facility, and broadly in the 3 areas of patient care, education and research, collaboration with regard to technical skills, clinical training, telemedicine collaboration. We have one very large telemedicine collaboration with Africa. So perhaps we could develop something on similar lines. And EMR systems, that is the record management systems, where we are currently working on with a number of companies like Siemens. That would be one more area of thrust. So some of these aspects have been incorporated into the draft convention which has been proposed for tomorrow. We'll discuss with our French counterparts what the proposals that have emanated from the speakers, Professor Balram Aaron, Professor S.K. Acharya and Professor D.K. Sharma have emerged today, and whether these points could be incorporated further into the convention tomorrow. But thank you very much to all of you. Thank you.
Merci beaucoup, M. Sévignas. Voilà, nous sommes arrivés au terme de cette première session et je voudrais très sincèrement et très vivement remercier tous les intervenants de la matinée car ils ont remarquablement atteint l'objectif de cette première session qui était de montrer l'existant, ce qui existe en matière de relations entre la France et l'Inde dans le domaine de la santé. Chacun a su nous montrer, soit de manière très globale, très générale, soit à partir de réalisations plus précises, combien il existe désormais, à travers des relations humaines, ce qui est l'essentiel, me semble-t-il, des liens solides, étroits, fonctionnels entre les institutions médicales de la France et de l'Inde. Dans les sessions qui vont venir, des éclairages plus précis seront donnés, en particulier dans le domaine des affections cardiovasculaires, dans le domaine de la cancérologie, dans le domaine également de l'innovation, de la formation, de la recherche, mais d'ores et déjà, il importait de dresser cette sorte de bilan, cette sorte d'état des lieux, et encore une fois, grâce au talent et à la pertinence des intervenants, je pense que nous avons atteint ce premier objectif. Je vous remercie et je vous invite donc au repas qui nous attend maintenant. Merci beaucoup.
Thank you, sir. I thank both the chairperson for chairing this session. Thank you, sir. I request all the dignitaries to join us for lunch. We'll begin our next academic session at 1400 hours. You are requested to be seated by 1350 hours. The lunch arrangements are done outside the auditorium on the ground floor. May I request the French guests, the faculty and the media personnel to join us for lunch on the first floor. Thank you.